You're trying to eat healthy, you reach for fruit because it feels safe. But then your doctor looks at your labs and says, your potassium is too high. And suddenly, something as simple as a banana doesn't feel so innocent anymore. If you're living with chronic kidney disease, CKD, this can be scary. Every wrong fruit choice feels like a step closer to dialysis. I know how heavy that feels. But here's the truth, not all fruits are off the table. In fact, some are not only safe, but they can help protect what kidney function you still have. There are fruits naturally low in potassium, sweet and refreshing, that you can enjoy without fear. And the best part? Eating the right fruits still gives your body the fiber, hydration, and antioxidants it desperately needs. Science backs this up. A large 2021 study followed more than 14,000 people for nearly 20 years. Those who ate fewer than 2 servings of fruits and veggies a day had a 45% higher risk of kidney failure than those who ate the most. That's powerful proof that fruit done wisely can be your ally, not your enemy. So in the next 25 minutes, we'll go through the 6 best low-potassium fruits, along with the exact serving sizes that help you stay safe. These simple choices can make all the difference between living fully and living in fear of dialysis. No gimmicks. No magic berries. Just real fruit, real science, and a plan you can trust. Because with CKD, it's never about giving up fruit, it's about choosing the right ones, in the right way. Fruit 6, lemons, just 80 milligrams potassium each. Let's talk about one of the most powerful little fruits for your kidneys, the lemon. When doctors mention low potassium fruits for CKD, they usually mean anything under 200 milligrams per serving. That's the safe zone where you still get the healing benefits without overwhelming kidneys that are already doing double duty. Half a lemon? Only about 80 milligrams of potassium. Perfectly safe, even for people with advanced CKD. But here's the magic, lemons aren't just safe, they're actively protective. They're almost sodium-free, just 1 milligram, extremely low in phosphorus, 9 milligrams, and contain no oxalates. More importantly, they're packed with citrate, the very compound that stops kidney stones before they start. Think of citrate as your kidney's bodyguard. It grabs calcium before it can harden into those sharp, unbearable stones that often land people in the ER at 3 a.m. And that's only the beginning. The vitamin C in lemons acts like a shield for your kidney cells, fighting off the daily damage that slowly chips away at function. Something as simple as half a lemon in warm water, first thing in the morning, can become a gentle ritual that protects your kidneys over time. The timing matters. 20 to 30 minutes before breakfast is ideal, when your body is calm and ready to soak up every drop of goodness. If the tartness makes you wince, a touch of honey is fine, just keep it light to avoid spiking blood sugar. When buying lemons, go for the heavy ones with bright, smooth skin, they hold the most juice. Store them on the counter for a week or in the fridge for up to a month. And here's a money-saving tip, when lemons go on sale, stock up, juice them, and freeze in ice cube trays. Each cube is a ready-to-go kidney-friendly serving. One last gentle reminder, that same citric acid that protects your kidneys can be tough on your teeth. Use a straw or rinse with plain water after drinking to keep your enamel safe. Fruit 5, cranberries, just 44 milligrams potassium per half cup. Here's something important to remember, every urinary tract infection, UTI, that makes its way up to your kidneys leaves behind scars. And those scars? They quietly chip away at kidney function, moving you closer to dialysis. That's why cranberries can be such a gift. At only 44 milligrams of potassium per half cup, they're one of the safest fruits for every stage of CKD. but their real superpower goes beyond just being safe. Cranberries are rich in special compounds called proanthocyanidins. Think of them as nature's non-stick coating for your urinary tract. They make it harder for harmful bacteria to cling to your bladder and kidneys, lowering your risk of repeat infections. And every UTI you don't get is one less scar on your kidneys, one more step away from dialysis. Nutritionally, cranberries are a dream for kidney health. Almost no sodium, 1 milligram, barely any phosphorus, 6 milligrams, and very low oxalates, 4 milligrams. For daily protection, aim for about half a cup of fresh cranberries. That's less than the price of a cup of coffee, but it can save you from a world of pain later. There are so many ways to enjoy them. Stir them into your morning oatmeal, sprinkle them over salads, blend them into smoothies with other low-potassium fruits like apples or blueberries, or pair them with a kidney-friendly yogurt. If juice is more your style, stick with 100% pure, unsweetened cranberry juice. When shopping, here's a neat trick: fresh cranberries that bounce when you drop them are the freshest. Look for shiny, deep red berries. That's where the most healing power lies. They'll last up to 2 months in the fridge, or you can freeze them to have kidney protection all year round. A quick heads up: if you're taking blood thinners like warfarin, very high amounts of cranberry, like a liter of juice a day or concentrated supplements, can increase bleeding risk. But normal food amounts are generally safe. So, small, tart, and mighty cranberries quietly guard your kidneys, one handful at a time. Fruit 4, watermelon. Just 70 milligrams potassium per cup. Think of watermelon as summer's sweetest gift and one of the gentlest ways to love your kidneys. With over 90% water, it acts almost like a natural dialysis machine, helping your body flush out toxins in a soft, supportive way, without the harsh side effects of medical interventions. And here's the surprise: unlike other melons, watermelon is actually low in potassium. 1 cup has around 70 milligrams, well within the safe zone for CKD. On top of that, it's virtually sodium-free, 2 milligrams, very low in phosphorus, 11 milligrams, and contains almost no oxalates. Safe, refreshing, and healing. But watermelon isn't just about hydration. It's packed with citrulline, a compound that helps improve blood flow so your kidneys get the oxygen and nutrients they need. Better circulation means better filtration, the kind of behind-the-scenes support that keeps dialysis further away. That beautiful red color? It comes from lycopene, a powerful antioxidant. In fact, a 26-year study of over 7,600 CKD patients found that those with higher lycopene levels had a 22% lower risk of dying from any cause. That's the kind of protection you want on your side. How to enjoy it? 2 cups a day during peak season, July to September, is perfect for hydration and antioxidant benefits. Eat it fresh as a morning snack. Blend it into a minty agua fresca, or freeze cubes to use as colorful, kidney-friendly ice in your water. Even the rind and seeds are rich in antioxidants that support both kidney and liver health, so nothing goes to waste. When picking your melon, look for one with a creamy yellow spot where it rested in the field. It should feel heavy for its size and sound hollow when tapped. Whole melons keep longer and usually taste fresher than pre-cut ones. A couple of gentle reminders: if you're on dialysis with strict fluid limits, the high water content needs to be carefully balanced. And if you're managing diabetes, remember to count watermelon's natural sugars in your daily carb allowance. Simple, sweet, and kidney safe. That's the power of watermelon. Fruit 3. Pineapple. 180 milligrams potassium per cup. When you think of tropical fruits and CKD, most of them are red flags: too much potassium, too much risk. But pineapple is the exception. the one tropical fruit that feels like a gift to your kidneys. With only 180 milligrams of potassium per cup, it stays well within the safe range. Nutritionally, it checks all the right boxes: very low in sodium, just 2 milligrams, minimal phosphorus, 13 milligrams, and oxalate levels low enough to be safe even for most people with a history of kidney stones. But here's where pineapple really shines: it's rich in bromelain, a natural enzyme with powerful anti-inflammatory effects. In fact, research shows bromelain can reduce inflammation markers like IL-8 by up to 40%. For your kidneys, that means less irritation, gentler filtration, and protection against the slow, damaging inflammation that often drives CKD forward. And that's not all. Just 1 cup of pineapple delivers over 100% of your daily vitamin C needs, wrapping your kidney cells in antioxidant protection. Unlike many sweet fruits that spike blood sugar, pineapple's enzymes can actually help steady glucose levels, giving your body energy without the crash. For the best results, enjoy half a cup of fresh pineapple about 30 minutes before breakfast. Taken on an empty stomach, the bromelain works more effectively, giving you a head start on inflammation control and all-day antioxidant support. You can also toss chunks into a kidney-friendly smoothie with apples or berries for a refreshing twist. When choosing a pineapple, look for a golden base, fragrant aroma, and leaves that pull out easily, signs of perfect ripeness. Avoid underripe green ones or those with dark, mushy spots. Fresh is always better than canned, since canned pineapple is often loaded with added sugars that undo its kidney-friendly benefits. Cut pineapple keeps well in the fridge for about a week, or you can freeze chunks for smoothies year-round. One gentle note: if you're taking blood thinners like warfarin, check with your doctor before eating pineapple regularly, as bromelain can enhance their effects. And if you notice a little tingling in your mouth from fresh pineapple, that's normal, but if it bothers you, it's best to pause. Sweet, tangy, and surprisingly healing, that's the gift of pineapple for your kidneys. Fruit 2, tart cherries, 173 milligrams potassium per half cup. Tart cherries aren't just good for you, they're like quiet healers, working against the inflammation that slowly wears down your kidneys over time. With just 173 milligrams of potassium per half cup, no sodium at all, minimal phosphorus, 15 milligrams, and low oxalates, they're one of the safest fruits you can choose with CKD. Sweet cherries, on the other hand, tend to run higher in these minerals, just another reason to stick with tart. What makes them so special is their high concentration of anthocyanins, powerful compounds that act like firefighters, rushing straight to the kind of inflammation that damages kidney cells and leads people closer to dialysis. On top of that, tart cherries help lower uric acid, which means they can also ease the risk of gout flare-ups, a common and painful companion of kidney disease. The science is strong. In one 2014 study, Montmorency tart cherry concentrate reduced uric acid levels by 36% and lowered an inflammatory marker by nearly 30%. That's real protection, both short-term and long-term. And here's a bonus you may not expect: tart cherries are a natural source of melatonin. That means they don't just protect your kidneys during the day, they also support the deep, restorative sleep your body needs at night for repair and healing. For the best results, enjoy about half a cup of fresh tart cherries a few times per week, especially in the evening when their melatonin content works in harmony with your body's natural rhythm. Add them to plain Greek yogurt for a protein boost, or blend them into a kidney-friendly smoothie with apples and blueberries. When buying fresh, look for firm, bright red cherries without soft spots during their peak season, June and July. Frozen tart cherries are a great option too. They're flash frozen at peak ripeness, so you still get nearly all the benefits year-round. If possible, go organic, since cherries can carry pesticide residues. A quick word of caution: tart cherries do contain natural sugars. If you're balancing CKD with diabetes, start small, see how your body responds, and always count them toward your daily carb allowance. Tart, healing, and even sleep supporting, these little red gems truly earn their place on your plate. Fruit 1. Pears, 116 mg potassium each. Sometimes the best medicine doesn't come in a pill bottle, it comes in something as simple and ordinary as a pear. Sitting quietly in your fruit bowl, it may not look like much. But bite into one, and you're giving your kidneys a gentle layer of protection against the toxic buildup that pushes so many people toward dialysis. From a mineral standpoint, pears are one of the cleanest, safest choices you can make. Low in potassium, 116 mg per fruit, virtually sodium-free, 2 mg. Low in phosphorus, 12 mg, and with only moderate oxalates, 10 mg, they fit almost every CKD dietary plan with ease. But their true strength lies in what you can't see: pectin fiber. This soluble fiber acts like a sponge, binding the harmful substances in your gut and carrying them out of your body before they ever reach your kidneys. That means less strain on your kidneys, giving them the breathing room they need to focus on their vital jobs, balancing your blood chemistry and producing hormones that keep you alive and strong. Then there's quercetin, concentrated in the pear's skin. Think of it as a shield, calming inflammation and protecting kidney tissue from daily damage caused by toxins and free radicals. That's why eating the skin is just as important as enjoying the juicy flesh inside. Pears are also naturally gentle, low in acid, easy to digest, and sweet enough to satisfy cravings without spiking blood sugar. For many with CKD, that makes them the perfect everyday fruit. For kidney support, enjoy one small pear with the skin each day. The timing is up to you, with breakfast for steady morning energy, as an afternoon pick-me-up, or sliced into a kidney-friendly salad. You can even pair pear slices with a little almond butter for protein and healthy fats that help slow sugar absorption. When choosing pears, look for ones that yield slightly when pressed at the stem but aren't mushy. Bartlett, Anjou, Bosc, different varieties, same kidney-friendly benefits. Let them ripen on the counter, then refrigerate to keep them fresh longer. A gentle note: if you're not used to eating much fiber, start with half a pear. You may feel a bit of bloating at first, but that usually passes within a week as your system adjusts. We want to thank you for being here, for listening, and for having the courage to embark on this journey of discovering what truly benefits your health, a journey that isn't easy, but is worth more than anything else. Hit the bell icon and turn on all notifications so you never miss a life-saving video. The sooner you spot kidney issues, the more you can do to keep things under control. If you're unsure about your kidney health and haven't been in good shape recently, check out the video on the screen here. We cover all the possible symptoms, helping you spot kidney failure and take action effectively if needed. See you there. Stay informed. Stay healthy.